Hi, Miss Bell. My name is Kayla. I'll be your nurse today. I'm going to go ahead and go over some discharge instructions with you. First, we're going to go ahead and start off with diet. Adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular again. Eat foods rich in calcium, which include dark leafy green vegetables, milk, and yogurt. Drink plenty of water and non sugar supplemented juices each day to satisfy your thirst and maintain your hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For activity, we're going to gradually increase your daily activities until you're back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks, or as instructed if different by your physician. Do not drive until you're released by your physician as well, okay? For breast care, your breast and nipples may have changed and or grown in size during pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking, and leaking may occur for several weeks to months. You may apply ice packs between feedings to ease any discomfort you may have. Breast care, if you're not going to breastfeed, wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs or ice packs for 15 minutes at a time every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Also, do not massage or apply heat to the breasts, okay? For breastfeeding tips, your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently, then reposition and try again. If you wonder how long you should nurse, as long as your baby wants to is fine, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It's important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above baby's ears, their ears may even wiggle, and not seeing dimples in your baby's cheeks. You and your baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it might mean that your baby is not positioned properly and that the tongue does not extend past the lower jaw. Remove the baby and begin again. Okay, any questions so far? Perfect. Okay, now we're going to go ahead and move on to hygiene. Wash your hands frequently as you're caring for yourself. To prevent infection, always wipe from front to back after going to the toilet, and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It's important to change your pad frequently, okay? As far as bleeding, vaginal flow will decrease in amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. For bowel movements and to avoid constipation, you can take a mild laxative or stool softener until bowel movements have returned to your normal pattern. And you can also increase fluids and fiber in your diet to help with that. For birth control, go ahead and discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Now to talk about sexual activity, nothing should go in the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until the bleeding has stopped and you feel physically and emotionally ready. This is very important. Warning signs to report to your healthcare provider immediately. So if any of these happen, just please call your healthcare provider as quickly as possible and let them know what's going on. These signs are going to be pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision, or if the incision begins to open, for perineal lacerations or C-section incisions. Discharge from the vagina that has a bad odor, severe headache or blurred vision or any kinds of visual changes, a temperature of 100.4, or you feel cold, feverish, or may have chills, you're going to want to report that as well. If you have any thoughts of harming yourself or your baby, please report to your physician as soon as you possibly can. If you have any pain or burning sensations, redness, warmth, or swelling in the legs, if your breasts are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks or flu-like symptoms, if you have any sharp pains in your abdomen or in your breasts or in your chest, if you have any trouble breathing, dizziness or faintness, if you have any crying spells or mood swings that feel out of control, if you feel like you're unable to empty your bladder or urination is painful, difficult, or too frequent, or if you're having difficulty having a bowel movement, any of those signs or symptoms, you're going to want to report to your healthcare provider as soon as possible, okay? We have a hotline number here for you if you need to report domestic violence or abuse, and that number is 1-800-96-ABUSE, ABUSE. And then I have some instructions for you for your infant. Safety is what we're going to talk about first. And sleeping, make sure you place your infant on his side or back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other seating devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used either. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parent, but not in the same bed. Avoid covering the infant's head or overheating. A bulb syringe. Keep the bulb syringe near the infant at all times to clear the infant's nose or throat if necessary. Clean the bulb syringe well with warm soapy water after each use and allow to air dry. Hand washing. Make sure you wash your hands prior to handling your baby. Car seat safety. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to the state laws, okay? For your home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant in the home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge, and do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Okay, for your baby's behavior, crying is completely normal response to for your infant. It's completely normal for your infant to cry. The most likely causes of crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking the infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Infants require a lot of sleep. You should be waking your infant at least every 3 to 4 hours for feedings. You should place your baby on his or her tummy each day for supervised tummy time because this will strengthen his neck and abdomen. Your baby's diet, if you're breastfeeding, your infant should breastfeed 8 to 10 times per day. per infant's cues. So whenever he seems to be hungry, go ahead and feed. While positioning the baby, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled, and skin to skin time is recommended. After feeding, hold your infant upright over your shoulder, gently patting or rubbing his back to burp. If you're going to formula feed, your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses a feed, awaken your baby. Your infant will gently take 2 to 3 ounces per feeding for the first few days of life and will need to eat every 3 to 4 hours. For positioning while feeding, be sure to hold your infant close to you. Your infant needs to be cuddled. Never prop your infant's bottle to feed. For burping, your infant needs to be burped every ½ ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. These are just some newborn characteristics that you may see that we want you to be aware of. Newborn rash. It's normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfume soaps at this time. Milia are pearly white bumps, usually on the face, especially the nose. They will disappear within the first week or so of life. Jaundice is common. It's a common occurrence in newborns. Your infant may appear to have like yellowish colored skin. It'll start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. For bathing your infant, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. As far as cord care, you want to keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify your pediatrician if any drainage or discoloration is noted. The umbilical cord will generally fall off within about 2 weeks of life, okay? Here's a few guidelines on wet and dirty diapers. You want to look for 1 to 2 wet diapers because that's normal for the first day or two of life. Then you should expect to have 6 to 8 wet diapers full of pale urine. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least one bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. For genitalia, for your female infant, always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent any diaper rash. Pat dry and then put the diaper on. It is normal for baby girls to have white or pinkish discharge. The secretions are normal and will gradually disappear, okay? For a male baby, if your baby is uncircumcised, always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent diaper rash and pat dry and diaper as well. For a circumcised baby, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat the baby dry and diaper him. Vaseline gauze is applied to the circumcision with every diaper change for about 24 hours. The head of the penis will appear red initially and then will change to have yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, this is when you should contact your healthcare provider. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by about 2 weeks. If you notice swelling, bright red bleeding, or green drainage, again, You should contact your healthcare provider immediately. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad and plain water. When dressing your infant, dress your infant as you would yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your infant to become overheated. Infants should receive all recommended vaccines. Next, we're going to talk about warning signs to report to your healthcare provider immediately about your child. There are certain warning signs you should watch for when caring for your newborn. Some general warning signs with newborns include, but are not limited to, no urine in the first 24 hours at home. This can be difficult to assess, especially with disposable diapers. No bowel movement within the first 48 hours. A rectal temperature of 100.4 or less than 97.5. A rapid breathing rate over 60 breaths per minute, or a blue coloring that does not go away. Newborns normally have irregular respirations, so you need to count for a full minute. There should be no pauses longer than about 10 seconds in between breaths, okay? Retractions or pulling of the ribs with respirations, wheezing, grunting, or whistling sounds while breathing, odor, drainage, or bleeding from the umbilical cord, yellow coloring of the eyes, chests, or extremities, crying, irritability, or twitching which does not improve with cuddling and comfort, a sleepy baby who cannot be awakened enough to nurse, any signs of sickness, for example, cough, diarrhea, or pale color. The baby's appetite or suckle becomes poor or weak. Call your child's doctor, your pediatrician, if you see any of the above signs, okay? Do you have any questions for me, Mrs. Bell? No? Okay, perfect. Here's your discharge paperwork. Thank you so much, and I wish you and your new baby all the best.